Hi, everyone. My name is Tamani, and I'm Generation Progress's Digital Media Associate. Last week, I spoke to you all about how mass incarceration is driving reproductive oppression, but this week, we're going to talk about immigration. Last weekend, hundreds of people across the nation gathered and they marched for abortion justice. And one activist who spoke at a rally here in DC is Margie del Castillo. Margie is the Director of Field and Advocacy at the National Latina Institute for Reproductive Health. Margie, I'm so excited that you're here. Let's talk about what makes immigration justice a reproductive justice issue.
We know basically that reproductive justice, right, is the right to be able to create the families that you may or may not want, right? And it's the right to parent if and when you choose. And so a lot of different things can come up in a person's life that can impact that ability to decide, right, on the family that you want. So one of those really key intersecting issues, especially for where we are at the Latina Institute, is immigration.
What are some of the barriers to reproductive care that immigrants face?
When we're talking about expanding healthcare, expanding access to abortion, birth control, all the different forms of reproductive care, a lot of folks talk to us about, well, okay, if I want to go to a clinic or to my doctor or provider to access those services, I actually need to be able to drive safely. So one of the issues that we saw consistently coming up was our undocumented community, right, often didn't have access to driver's license. That was a specific example in Virginia until recently. And if folks didn't have the ability to drive legally and safely, then they wouldn't be able to access the care that they needed, right? And so that is literally interfering with their access, and that makes it an issue of reproductive justice. So really all of the pieces that may come into your life around immigration, around your status, around how you identify, your economic situation, right? The caregiving role that you may have, all of these things can definitely impact someone's ability to have the family that they want. And so, yeah, immigrant justice is reproductive justice. Clinics are being, harmed and shut down by these unjust laws. Then there is literally nowhere to go to access abortion care. And so that's a real barrier that folks are facing. In addition, beyond the Texas example, but also including it, barriers to abortion can include so many things, right? It can include access for language justice, right? Like, are the clinics that may be near you, actually have like services in the language that you need? Does your state resources provide things in your language, right? To be able to say, like, you can access reproductive health care here, but in a language that you understand. There's also just the issue of economic, right? The economic issues. So there's situations around, like, do you have paid time off at your job, right? To be able to take off for a day, 2 days, 3 days to access the care that you need. We know that in many states, there's rules around mandatory ultrasounds and mandatory waiting periods that end up lengthening the time that an abortion procedure takes. And so if an abortion procedure is going to take 3 to 5 days, right, instead of the few hours that it should take, that may actually be a tremendous barrier for someone that doesn't have any paid time off from their work, right? They may not be able to take those 3 to 5 days without possibly losing their job and their income. So those are just some of the real barriers. And, a shout out to all the abortion funds, people on the ground who are actually like providing that practical support, providing help, even in the way of like paying for hotel rooms, paying for gas, because those are some other barriers that people face in being able to access the abortion, not just what the cost of the abortion is, which can sometimes be high, but also all the other factors around, right? The gas to get there, a hotel maybe for an overnight stay if you're traveling far from your home location. So there's a lot of barriers out there, but the good news is that there's a lot of amazing work happening at the state level to take down those barriers and then to increase access.
What are some policies the Latina Institute is working on to improve reproductive justice for immigrants?
One of the key pieces that we're currently working on is the HEAL for Immigrant and Families Act. And so what HEAL would do is help open up healthcare access for a lot of categories of immigrant people. And it doesn't necessarily provide healthcare access to every person. For example, we're not talking about undocumented immigrants necessarily within that, HEAL Act. It doesn't solve every problem, but it does solve a lot of problems, and it opens up access to people who, for example, are waiting 5 years to become, to have 5 years of permanent residency, for example, right? It opens up access to healthcare for quite a few categories of immigrant people. And so we're really excited about that. Another solution that we're moving at the state level is happening in Virginia. It's called the Reproductive Health Equity Act. And that piece of legislation has been introduced now for 3 years. It'll be introduced again in the 2022 legislative session. And that is actually going to expand access to all forms of reproductive health care at either a limited or free cost to every Virginian, regardless of their immigration status, regardless of how they identify, right? So we're opening up access to reproductive health care for trans people, for gender nonconforming people, to be able to fully thrive. And so that's really exciting because those avenues for access do not currently exist. So between the HEAL Act at the federal level and the Reproductive Health Equity Act at the state level in Virginia, we're making a lot of progress, which is really exciting. And we're still also fighting back against a lot of detrimental policies out there, right? Like SB 8 in Texas, the abortion ban, near total abortion ban, right? In Texas that just passed. And we know there's a lookalike coming in Florida very soon. So, for the Latina Institute that works in all those states, we're pushing progressive vision out there, and we're also pushing back against attacks and also visioning in those spaces too, because while we defend ourselves, we also know what our community wants and needs, and we're trying to put those proactive things forward.
What should people know about the fight for immigrant justice?
Right, those disturbing images of Haitian refugees coming to the border, being violently attacked by Border Patrol and ICE agents. So I think folks need to be really aware of who those faces are, right? Who are those people coming to the border, right? Who are the people that are being attacked, and also how much racism and anti-Blackness is playing into what is happening, right? I mean, we have plenty of asylees and immigrants that come in who, may be white, right? Who are not receiving violent attacks, as that we're seeing the Haitian immigrants that are coming to our border for help are receiving. And so I think being really plugged in into who those people are, because a lot of times I think we consume image after image of violence, and sometimes we don't, actually look at the person who's there, right, and what their story is. If folks are getting into the immigrant justice spaces for the first time, making sure that we're uplifting the experience of all immigrants, right? So like I mentioned, Black immigrants, people who identify as women, right? We know that women are often leading in immigrant families, making decisions, right, for their families, but sometimes they're not always represented at the table. And that's a lot of what we try to do at the Latina Institute with our base, is uplift and empower the voices of Latina and immigrant women who are making decisions and running their families and are leaders in their communities, and uplifting those perspectives to people in power and speaking truth to power. So just remembering that the immigrant experience is broad, and it's very deliciously vibrant, and there's so many different perspectives. And so as the media, et cetera, tries to paint the immigrant experience as one thing, I think for folks new to the movement, just start to talk to your neighbors, get in with community groups, local organizing, and realize that the immigrant experience could look a really different way in your own neighborhood.
Margie, thanks for joining me today. As always, if you want to learn more about any of the issues we talked about, just visit genprogress.org.